Brandon Steen. I'm a shoulder specialist orthopedic surgeon with Florida Orthopaedic Associates. Today, I'm going to answer some patient questions about shoulder surgery. Here's a question we have from our Orange City office. The question says, how do I know if it's the right time to have shoulder replacement surgery? Shoulder replacement surgery is really designed for patients where no other option is providing adequate relief and the shoulder pain is getting to a point where it's affecting quality of life on a day-to-day basis. With moderate pain, we tend to try to treat things non-operatively, and a lot of patients can get by without surgery for a long time. When you start having night pain that wakes you up every night, you start changing your life and giving up activities you want to do because of the pain in your shoulder, or you start losing independence, we typically recommend joint replacement. Recovery is approximately 6 months after joint replacement surgery. Pain relief typically comes within several weeks after surgery, and most patients will have an improvement in their quality of life within the first several weeks after a shoulder replacement.